Hello, today I'm presenting video 2 for ANSC 345 and I'm going to talk about Chronic Degenerative Valve Disease or CDVD. CDVD is a degenerative disease in the valves of the heart. It is not caused by any kind of infection, but instead most of the cases is mostly due to aging of the animal. The valves that get degenerated are the tricuspid and especially the mitral valve. Due to the degeneration of the valves, it is possible to see that they have greater thickness and lumpy appearance, which due to these physical changes the valves are unable to shut completely. This will cause the blood to leak backwards into the upper chambers, atria, which this leakage through the damaged valve is known as regurgitation. The blood leak may cause a sound known as a murmur which can be heard with a stethoscope. The leakage will cause the heart to change since it could increase its size and weaken the heart muscle, thus causing congestive heart due to the changes in blood flow. One of the clinical signs that we can encounter are respiratory problems that we can see in increased breathing with over 30 to 35 breaths per minute, especially when sleeping, increased effort to breath, and coughing. Another sign is ascites, which I'm going to explain more deeply about in the next slide. It is possible to encounter a change of activity in the animal in the way that may spend more time resting than they used to, get more tired easily, and having much lower stamina when performing some activities like getting more tired when taking a walk. Also, we encounter instances that dog may faint, which is something to pay attention. The dog is young since there is a chance of a congenital heart disease. The reason why the dog has lower activity, tired, or faint is because the heart is unable to pump enough blood to the body. The affected canine may also have difficulties to sleep, which are constantly changing sleeping positions or sleeping on a lion pose position, and restlessness. It should be important to note that these are just some clinical signs about the disease. Not all clinical signs should be present for the dog to have CDVD, and that CDVD can be asymptomatic, meaning that your dog can have the disease but still not present any clinical signs. What is ascites? It's a condition that causes liquid buildup in the abdomen of the animal. The liquid does not stay in a specific spot in the abdomen. Actually, it is able to move freely through the abdomen. There are multiple underlying causes can cause disease that can be due to liver problems, heart problems, cancer, among other problems. As you can see in the image on the top, the area where the fluid build up in the abdomens, and you can also see most of the organs located in the abdominal cavity. When the fluid starts building up, some of organs are going to start floating in the abdominal cavity. The image below, we can see that its belly is not proportional to the rest of its body. You can almost see very clearly the spine of the animal, but then you see its abdomen, and it is bloated or enlarged. As the name suggests, this is a degenerative disease. The three main causes of this disease are aging and breed of the dog. Small breeds that are around 20 kilograms or less are more prone for CDVD than larger breeds. Some of the breeds that are more prone are Teckles and King Charles Spaniels. Cavaliers Kings and possibly other breeds could have possibility of developing the disease early on by only having 2 to 3 years old. The third cause is overweight, which increases blood pressure and put more stress in the heart. In this slide, I included a table from the American College of Internal Medicine that helps classify or quantify the severity of a heart disease which can be applied for chronic degenerative valve disease. We start from stage A, in which it applies for dogs that are prone to get CDVD. However, they still haven't contracted the disease. Stage B1 is when there is a presence of a heart murmur, but the chambers of the heart don't appear to be modified or changed. Stage B2, there is heart murmur present, possibly with sound louder because the leaks in the valves are getting larger, the heart appears to have grown, and blood pressure has increased. Nevertheless, there are no clinical signs, and treatment would not be necessary at this stage. Medications can be given by your veterinarian. Stage C, also known as the symptomatic stage, is when the clinical signs start developing. A plan for treatment is made and more medications are given to improve quality of life as well as manage the symptoms. Congestive heart failure clinical signs may also develop, but can still be managed. Finally, stage D is when the clinical signs worsen and the dog is not responding to treatments nor medications. Currently, it is not possible to reverse the degeneration of the valves. However, it is possible to give the dog a better quality of life and manage some of its clinical signs. Treatment may vary depending on the stage of disease and appearance of clinical signs. Some medications that may be prescribed to prevent as much as possible heart overload are diuretics, which aid in the management of fluid building up, positive inotropes that strengthen heart contractions, and vasodilators to reduce stress in the blood vessels. Exercise should be kept in moderation and at the dog's pace. It is important to know your dog's limits when it comes to physical activities, which is important to talk to your vet before performing a moderate level exercise. Keep your dog in a healthy weight. Usually overweight dogs will have more difficulties to maintain a healthy heart. Try to also keep your dog from getting stressed, since it can put stress in the heart. If the dog presents ascites, treatment will focus on the removal of the fluid. However, it is important to note that fluid will still accumulate again over time. This can be by abdominocentesis, which is a non-surgical procedure that does not require anesthesia. The procedure requires a needle to punch through the abdominal cavity and drain any fluid in the cavity. Reducing sodium intake may help reduce the accumulation of fluid in the cavity. This can be done by providing low-sodium diets and diuretics, which will help increasing sodium excretions by urine.